Are you confused about the difference between endometriosis and adenomyosis? Don't worry, patients and practitioners alike are frequently confused about what's the difference between these two conditions, how do we diagnose them, what options are available for healing and reducing the symptoms of these conditions. So let's dive in. First, let's define each condition. Endometriosis is a condition in which tissue similar to the lining of the uterus, the endometrium, but not exactly the same, is found outside of the uterus. All over, it can be anywhere, all over the body, but it most commonly is well known for being on and around the reproductive organs outside of the uterus, on the fallopian tubes, ovaries, all over the bowel, bladder, can be on other soft tissues like uterosacral ligaments. But it can also be these lesions of tissue which are growing in the wrong place, if you will, but again, not exactly the same as endometrial tissue, can be found in as far-flung places in the body as inside of the nose, on the knee, on the diaphragm, on the lungs. So it's a systemic whole body disease that leads to a number of symptoms, everything from fatigue, headaches, insomnia, breathing problems if it's on the lung or diaphragm, digestive issues, bowel bladder problems, sexual pain, pelvic pain, fertility issues, and much more. It's not just painful periods, it's a full body systemic disease. Adenomyosis is a somewhat similar condition, but these lesions are specifically within the muscular wall of the uterus. That's exactly and only where those tissue lesions are, though the tissue type is very similar to endometriosis, causing the lining and the muscular part of the uterus to swell and thicken. Adenomyosis typically does not involve lesions outside of the uterus. However, both of these conditions can coexist within the same person. And similarly, you'll have heavy menstrual bleeding, painful periods, sexual pain, general pelvic pain, and fertility issues, and then more of these more systemic challenges, mostly fatigue, anxiety, and depression, and other symptoms related to imbalances in neurotransmitters and stress to the mitochondria. So how can these two conditions be diagnostically distinguished from one another? Is there just a nice, simple blood test or imaging test we can do to determine if you have endometriosis or adenomyosis, both or neither? Unfortunately not. There was a recent study that has shown that transvaginal ultrasound combined with looking at the blood test for CA125 had a sensitivity of 82% and a specificity of 88% for the diagnosis of endometriosis. Unfortunately, this approach is not specific for adenomyosis, although you can have some times you can see adenomyosis on MRI that may be more useful. Unfortunately, the only way to truly diagnose endometriosis is through skilled laparoscopic excision surgery, which must be done by a practitioner, by a surgeon who does this kind of particular surgery day in, day out. They're highly skilled at it, and often they will go into the surgery with a plan that includes having a bowel surgeon on board and or having a thoracic surgeon if there is suspected endo outside of the abdominopelvic region. Unfortunately, the only treatment for adenomyosis from conventional medical treatments is a hysterectomy. However, that may be, something that is held off on until much later. And unfortunately, that's the only way to diagnose adenomyosis is to look at the histology of the uterus after hysterectomy. Once diagnosis has been made, what are your treatment options for dealing with endometriosis and or adenomyosis? Well, while the mainstay of recommended treatment by traditional gynecologists is hormonal therapy such as hormonal birth control, oral contraceptives, or GnRH agonists, these therapies at best only provide symptom relief and do not halt the progression of the disease. Minimally invasive laparoscopic surgery is the preferred surgical option for endometriosis, while in most cases an open surgery is preferred for adenomyosis. And occasionally there are surgeons who will do a more of an excision type surgery to the uterus, even in cases of adenomyosis, but in most cases, hysterectomy is recommended. So again, I strongly recommend working with a specialist physician in regard to having your surgical consultation. There are absolutely people who specialize this and then are aware of the more extrapelvic potential challenges of endometriosis being outside of the abdominal pelvic region, which is really important if your surgeon is also going to have to do a more extensive surgery. Now, the way we work, so my name is Dr. Jessica Drummond. I am a clinical nutritionist, a physical therapist, and a health coach. And what our work is at the Integrative Women's Health Institute is to give you and our clients and our professional students a strategy for pre-op and post-op care. And because endometriosis, while it can be severely quality of life threatening, is not a life-threatening condition, it's not necessary in all cases for people to have surgery. Sometimes surgical care is unavailable or out of reach financially, depending on where a person lives. And sometimes a person simply chooses not to have endometriosis surgery. And so our approach is to take a holistic, full body, non-medical, but a health optimization approach, root cause healing by optimizing the physiologic systems to reduce overall symptoms. And there is quite a bit of research support for using the particular strategies that we support our clients to implement. And some of that involves building a team of integrative practitioners, including pelvic health specialists, physical therapists, yoga teachers, and acupuncturists. That's where we have the most evidence-based for a collaborative approach. We also have an evidence base for starting with a sort of controversial but really important mindset shift that is applicable to endometriosis and adenomyosis or both, but also to any chronic illness, because many of our clients with endometriosis also struggle with things like dysautonomia or mast cell activation syndrome or celiac disease or Hashimoto's autoimmune thyroiditis, and a variety of other things. So while this mindset might seem counterintuitive, that if you have a chronic illness, your job is to go out in the world and find the person who can heal you, I'm telling you right now that your power to be optimally healthy exists within you. And so shifting your mental attention from searching for symptom relief or cure to how to live fully, and shifting the attention away from your diagnosis. It doesn't mean you're not taking care of your health. You actually will be even more taking care of your health on a day-by-day basis. But shifting from a kind of whack-a-mole approach to symptom management or looking for that elusive cure or treatment from an outside provider to finding a clear pathway, investing some time in understanding your diagnosis, collaborating with your healthcare team, and then shifting your mindset to having a really positive attitude around your capacity, your body's physiologic capacity, your nervous system's physiologic capacity for healing. And there are multiple research studies that support that shifting your mindset towards optimal health, optimal happy and healthy living versus trying to, squash a symptom of your endometriosis or adenomyosis will actually reduce your symptoms. And this is not at all to say that your symptoms are all in your head. This is to say that you have vast physiologic, biochemical healing power that starts with a nervous system mindset of belief in your body's capacity to heal. And in our practice, we have adopted the phrase used by Dr. Jeffrey Rediger in the book Cured, the upward spiral of healing. And as we shift the mindset towards the upward spiral of healing, it's not an upward straight line, right? There's not this automatic magic wand, bullet treatment. But as you begin to take slightly better and better and better care of your digestive system, of your nervous system, of your immune system, of your musculoskeletal system, that your symptoms will generally and gradually decrease, not all the time, not in a straight line, there'll be bumps in the road, but your overall health will become more and more robust and resilient. So that's step one of a comprehensive integrative approach to healing either or both endometriosis and adenomyosis. Second, we want to optimize nervous system regulation. And I can't emphasize enough how important this is. So there are 3 states in the nervous system: sympathetic upregulation, where you're like anxious and jittery and fight or flight; freeze state, which is dorsal vagus activation. That's your parasympathetic nervous system being just stuck and fatigued and depressed and unmotivated. Or there's calm awakeness, where you're able to interact with others and be calm but really engaged in life. And that is the nervous system state of ventral vagus activation that is the most conducive to healing. And other studies have looked specifically at healing, regulating the nervous system, but also optimizing balance of neurotransmitters and neuroendocrine components, your brain hormone communication relationship. And as signaling in the brain optimizes and turns on certain genes to regulate your immune function, to balance your hormones, that is when we start feeling less stress, having better sleep and sleep quality, being less upregulated. Again, you can see how that helps to support someone move up on that upward spiral of healing. It's very challenging to heal when you're not sleeping well, when you're under significant stress, when you have insomnia, that you don't have any strategies for getting good rest when you can't sleep. So we teach these very specific strategies inside of our Advanced Women's Health membership program and in our programs in Outsmart Endo at outsmartendo.com. So additionally, for a full comprehensive approach to deep healing and to learn to support your clients to heal deeply, also it's important to address digestive system function, healthy, balanced gut microbiome, adding nutrient-dense, anti-inflammatory, not just foods, but also lifestyle, herbs, culinary herbs, sometimes supplementation and herbal supplements, immune system regulation. So your immune system is not too hyperactive where you're chronically inflamed and you can be turning on some genes that or even support some of the gut bacteria that increase the risk of autoimmune activation of the immune system. It's balanced between kind of cleaning up any messes, being targeted against any invaders, but not dealing with that sort of chronic inflammation state. Mitochondrial support. We can't talk about optimal deep healing without addressing our mitochondria. The mitochondrial energy is essential for optimal healing because it takes so much literal ATP, literal biochemical energy to fully heal. Musculoskeletal health in collaboration with a skilled pelvic floor physical therapist or occupational therapist, as I have already discussed. And community support and lifestyle management. People who are actively socially engaged, who have spaces in their home, in their life, in their body, in their experience, where they feel a complete sense of calm and safety. People who are actively seeking happiness and joy, even on days where they don't feel very well when they wake up in that morning, literally heal from the inside out. So while endometriosis and adenomyosis are similar but very distinct common gynecologic conditions affecting more than 1 in 10 people with uteruses all over the world, these two conditions cause similar symptoms, but do require different diagnostic techniques, involve different parts of the body, impact fertility and other health issues differently. And so it's very important to understand, are you dealing with endometriosis and adenomyosis, or adenomyosis alone? And how your case is impacting your actual symptoms, because people can have fairly mild cases of either of these disease processes and have very significant symptom pictures or life limitations. And the opposite can be the case, where people can have very extensive cases of either of these diagnoses or both, and be able to live fully and experience fewer functional limitations and just overall be healthier. So a lot of what you do has nothing, in terms of your health, has absolutely nothing to do with either of these diagnoses. It's the day-by-day mini steps of how you choose to live and how you choose to take care of your health with little tiny step-by-step behaviors each day. And to learn more about our approach, you can visit us at outsmartendo.com if you are struggling with either of these chronic conditions, or you think you may have either of these chronic conditions, or if you are a practitioner looking to learn this comprehensive approach to healing endometriosis, adenomyosis, or other chronic health conditions, visit us at integrativewomenshealthinstitute.com.